It's your girl So Fab, and of course, it is TDS Radio, Music Bed, cousin. There we go. Yes, that's what I'm talking about. We are live. We are here for this special edition of TDS. Unfortunately, Coach Block is not with us. He is sick, so please send him your well wishes. You know, he doesn't like to listen when we tell him to take medicine and be preventative. So now he's feeling the after effects. But send him, you know, your well wishes. Send him some love and let him know that we're thinking about him and to get better. And we will be back at it. But of course, we got work to do because we got to pay these bills. So we're here with Dr. Janze. Now, y'all, Dr. Janze, this is her first episode of Embody Balance. So y'all got to give it up for her. Hey, now, hey. So she's sitting right next to me. And I'm pretty sure now, if y'all been following me, as you should have, you've been following me, you know this other face down here, Miss Jewel, because that is my girl. Now, during COVID, we had a lot of conversations. Anytime I do something, homegirl is coming with me. You hear me? Hey, now. So we have Miss Jewel over here. And then now y'all heard us talk about our cousin off screen. Now, Richard, you'll hear him in the background from time to time. Well, he's finally helping us out. He's running the boards. You know, he was Tim the Tool Man. He was also making sure that we had our set together while I'm trying to do, you know, the mechanics of it all. So give our cousin off screen, now on screen, Richard, some love. And we are going to get right into it, because we have some things to talk about. So this episode is going to be about, you know, balance, as we said. Everyone wants to get into weight loss or just feeling better, making sure that, you know, they're taking every day, living their best life. And there's a lot of questions centered around injections. We talk about Ozempic, Wegovy, Mounjaro, Zepbound, all of those. We actually have Dr. Janze, who's going to answer some of those questions. And then we have Jewel, who is going to talk about externally, your skin, and just making sure that you are putting your best foot forward. And this conversation is not only for women, but for men. So guys, don't go anywhere, because you need to jump in on this conversation. Right, cousin?
Yes.
Because men don't like to wear sunscreen. So first and foremost, Dr. Janze, now you have Embody Hydration and Wellness. And the one thing about your stop is that you do IV drips, you do injections, and essentially you do a whole entire consultation to kind of get people centered and figure out what it is that they need. So tell us a little bit about, you know, this whole fad, because it's becoming a running joke with Ozempic, which I don't think is funny. If people are deciding to use Ozempic to aid their weight loss, allow them to. But let's let people know a little bit about the injections and what it is they actually do.
So, hey y'all. Thanks for joining. So I am Dr. Janze. I own Embody Hydration and Wellness. And so one of my focus is weight loss. And so with weight loss, I offer a couple of options. And what I encourage you to do, if you're thinking about weight loss, please don't ponder too long. Set up a weight loss consultation with me, and we can talk about the different options. And so when it comes to your Wegovy or Ozempic, Zepbound, Mounjaro, those are really popular now because they have shown so much improvement with weight loss. It works. Now, there are side effects, and we talk about all. But I like to encourage people and just have that discussion or educational discussion, because it's not just, you know, about diabetes, people going to work out, or you just eat right. Because when you really think about it, everybody's body is different. So what diet works for me may not work for Kim, may not work for Jewel, may not work for Richard. And so everybody's body is different. And sometimes as we age, we have a lot of things in play. You have your hormones, stress level, cortisol. It's just a whole lot of stuff that no matter how much you're eating right, you're walking, exercising, you're just struggling to lose weight. And
Absolutely.
So for me, it was a personal story. I am she, and I am that.
Hello.
Oh. And so I struggled with weight loss. I actually had a total hysterectomy last year where I gained weight. And so it was a struggle, and I'm not one to eat terrible. I've done lots of fat diets. I've tried the keto diet. I've tried low carb. I've tried the high protein, low carb. This, I've paid for a lot of things. I've been on Phentermine, all that stuff. Even some of the things that you see on TV.
Right.
I've tried it. And so for me, weight loss was a personal thing. And so I want to be able to offer people that opportunity to feel good about yourself.
Right.
And I don't regret it one bit. Now, I have been on it because if I'm going to offer something to you, I'm trying it myself.
Right.
This has been a game changer for me, and I've not felt physically this good in a long time. So when I had my surgery last year, I actually gained about 10 pounds. And it was so hard to lose. And I hear a lot of people say after they've had their surgery, they had a hard time losing weight. And so, of course, I'm over 40. I may not look it.
I know that's right. Let them know. Let them know.
Mid 40s. And so it's just as you get older, your body just changes.
Absolutely.
And then after kids, it's just a lot. And so I encourage people not to, just because diet and exercise work for you, it may not work for everybody, but just be cognizant of people's emotion.
Absolutely.
And stop being so throwing your opinions out at people so often, because it's different for everybody.
Absolutely.
And it's a personal journey, and it's a sensitive journey. And for me, when I lost the weight and I looked in the mirror and I was like, oh, I can put this shirt on and not see my roll.
Right. Yeah.
Or I feel like I got on, my son football gear because, I'm unbig in my back.
Right.
Yeah. For me, it's just really, it was about self-esteem and just looking good on whatever I can put on now.
Absolutely. And I think we all collectively can jump in on this conversation. Of course, you guys watching too, you can jump in on it because we've all struggled somewhere when it comes to weight or image. It doesn't have to be a weight thing. It could be acne. It could just, it could be anything, body hair, things like that. But one thing that people always seem to, like you said, and I'm glad you pointed that out, what they resort to is, oh, just eat right and go to the gym. You don't think people are doing that? Like,
Right.
You don't think that that's a factor in there?
Easy,
Right.
We would all be
Exactly. But some people need that extra help.
They do. And it shouldn't be shameful, and they've made it shameful. We're not taking away from the people that have diabetes. We're not. So take that out, the whole, it's a shortage because of the manufacturer. So there's a lot of things. And so, I try to educate people, and I made a personal post I shared about my journey. And I saw another post about someone that owned the gym, and they said, showed this muscular guy that was lifting weights and was like, oh yeah, he in the gym because he can't get his Wegovy. And I'm like, oh my gosh. And I ain't gonna lie, y'all know that was such ignorance. And now I had to take a step back and, because I took it personal, because it's like, no, like, one, understand what you're talking about.
Right.
Exactly.
Right.
Before you go and make a whole statement about that. And then, okay, people, yes, I encourage people on this plan. When you come see me, we talk about diet and exercise. It's not just doing this weekly injection that's going to get you to the, where you want to be. But to really see great results and get your body tone, you do need to incorporate eating habits and working out. And I like to call it lifestyle change. Because
Absolutely.
diet is such a, bad word. And it's all about lifestyle, because once you get to your goal and you get to that weight that you want to be at,
you got to maintain
it's
that.
a lifestyle change. And so I do encourage that for all of my patients that I see.
Absolutely. And the other thing, like you said, when it comes to lifestyle and just people just having sensitivity, it's now become a joke even in pop culture. Because there are a lot of celebrities who have decided to get Ozempic, and a lot of these celebrities, we've seen them battle with their weight. Like Kelly Osbourne is one of them, where we've seen her go up and down. And there's various factors as to why someone would do that. We don't know. So just actually having a little bit of grace and not judging someone depending on their journey. And if this is what they want to do to make them feel good, allow them. Right. I do know most recently AB, which, we're not even going to claim him, but the previous, prior Pittsburgh Steelers who decided to, jump on the Trump bandwagon, he made a comment about Lizzo, because Lizzo was, writing something. And I mean, now granted, she was holding the pen a little elementary, but that's neither here nor there. But he was like, oh, she's holding that pen like her Ozempic injections. You don't know what that girl did. Why are you in her stomach, in her mouth, and in her business?
That's her business.
Exactly.
And that's the thing I think we miss totally. Like, you are so much in people's business.
Mhm.
Stay out of it.
Immediately. Hey now. Because if it's not affecting your wallet and your day to day and your health, why does it matter? And we talk about that a lot on this platform. And that's why I wanted to bring you on here to not only talk about that, but talk about some of the myths. Because I also hear a lot about some people using the injections and they're like, well, it makes me sick. I can't do it. I'm throwing up. I'm not even able to actually maintain or keep any food down, which also scares people and might essentially make them say, well, I don't know if I want to do this.
Yeah. So absolutely. And that's one thing that we talk about. And I'm very honest about side effects. And so you have two options. And so it sounds like four different medicines, which the names are different just because of how FDA approved it. But there are side effects. Now, with any medication you take, anything, there can be side
Mhm.
effects. And so nausea, vomiting is definitely one because the way the medicine works, it actually slows digestion. So that's why you're feeling full longer, and you're not as hungry. Now, because that food just slows down, sits kind of in your digestive tract and it takes its time going through, people feel nauseous. And some people, it can cause vomiting. That's an unwanted side effect. And so some people do better than others. Again, this is not a one size fit all. What works for you may not work for someone else. Um, and so I have people that are on semaglutide, which is the compound for Wegovy, because a lot of insurances don't cover it.
Right.
So they come to me, and I'm able to help them. And so one of the side effects really is, and so I have people that are on it that do well, and I have some that I've made them nauseous quite a bit, and they may not have lost as much weight as they like to. And so I do discuss both options. So when you have like Mounjaro or the tirzepatide, that one has shown better, weight loss for most people, lesser side effects, but you still can experience those. And so I go over all that. I tell you all the things that you can potentially experience. I even tell you about my experience, because it's essential that you know what you're doing and that you're well versed on it. And I also have my patients sign consent forms. And I list every side effect that's in there. And it's a lot.
Yes.
And so because it's important for me that you are well educated on what you're doing. And I tell folks, listen, we're in this together.
Mhm.
I'm not just coming, here's your shot, here's your vial, give me your money.
Girl, because I
and tell
text you
about
this
my
week,
business.
honey. I ain't gonna put my business out there, but I was like, Dr. Janze, quickly, help me.
Yeah. And so, I'm here to help people get better. I didn't start this business just because it's cute. Clearly, it ain't. Running a business is not cute.
Say that again, please.
It ain't always fun, and people don't tell you
Right,
all the stuff you go through. They make it look cute.
Mhm,
Okay, yeah,
mhm.
it's cute because I got my hair curled today.
Hello.
Okay.
Mhm.
I showed up. There you go.
Period. Goodness. So we have a comment. It says, what's crazy is it's weight management too. They are on the phone telling people to get up and work out to lose weight. So one, they don't, read the chart. She said, so I wait until they ask me how I gain weight. And I say, oh, you know nothing. She had a stroke and now I'm in a wheelchair, and they're dumbfounded. Because people don't know people's stories. So you're sitting here saying, oh, well, why are you gaining weight? I can't move the way that I wanted to move. So I might have to get an injection, or I might have to do certain things because my lifestyle has changed. And it says, but I agree, it's not always so simple as go to the gym and eat better. Well educated, informed, and experienced. Hello. All right, Miss Tabitha. Thank you, girl. So Jewel, let's talk a little bit about skincare.
Yes.
Because as you're losing weight, things change. Like Dr. Janze was saying, we talk about hormones, and that can have an effect on your skin. So what are some things to be mindful of as you're on your wellness journey?
So a lot of times when you're on a complete and total different journey, I never forget when I was in therapy and I was on this total transformation. You remember, she was saying when mind, body, and soul connects, they all have to go together. So these are things you have to think about when you go to doc and you talk to her about weight loss, and she tells you side effects. So if you're losing things, your hormones are changing. So you also have to keep in mind of vitamins that you're taking.
Yes.
A lot of people, and it has nothing to do with all the crazy stuff out there. People see you taking vitamins that has nothing to do with weight loss or anything like that. It just means that your hormones are changing. So you might have less of something, more of something, and you need a balance. So I tell people, yes, when you're doing facials, you also have to do maybe vitamin C, some more, different things like that. Because the dullness in your skin, you could be losing it as you're starting to lose weight. You know what I mean? It just depends on how everybody body reacts differently. So I tell people a lot of times vitamin go hand in hand. Of course, water. Water is number one for great flawless skin. I tell people that, and especially like when you're doing alkaline water and things like that, you got to make sure you balancing your pH. It's too much alkaline, you'll start breaking out. So you just have to really be careful and kind of scale back. Just because somebody say hydration, you just have to be careful with your salt intake. People are putting pink Himalaya salt in your water now, and then you wondering why your skin is very like dry and it's and you swollen, you're having all these different things going on with your skin. So you just have to be very careful. And I tell people, as we become refined, as we become vintage, our skin starts to lead us. So if it's too much of something or your skin doesn't like something, it's going to be reactive. It doesn't always mean breakout. It could be, could you please stop putting that glycolic on my face over and over again? Like, yeah, we had one pimple, but I don't think we need it all over, you know? Or a lot of people now are going to like retinols trying to, preserve and get crow's feet, but you don't know that you're drying your skin out. And so I tell people all the time, if you're going on a fitness journey, which I definitely went on a whole transformation.
And that's my girl.
And I shout out to you for all the people. I keep telling her she needs to ask him, business. But all of that goes hand in hand. So you just have to be mindful of when you're on your weight loss journey. A lot of times you have to cater your skincare to what's going on in that moment and be okay and I tell people steadfast and just be patient because it's going to change. Right. Like 1 minute you may start off, oily. As you start to regulate and you drink water, you might become normal. Then once you get your weight under control, you might become dry. So you just have to be open to, if you're changing your lifestyle with your weight, you have to change your lifestyle with your skin. So it's a completely total. And then once you do weight loss, you do skin, and then here comes the mind with therapy. Yes. So all of that starts to line up together. So just be open. I tell people be open because it's a journey.
Because I went through that too. Like my skin, I started like my T-zone is oily. And then I noticed like at some point I had a little bit of dryness, but it's just almost like it's a normal skin now. I don't have the oily T-zone like I used to. My face really cleared up because I've lost weight. I'm not putting a lot of junk in my body, even though I wasn't eating terrible. But the amount of stuff that I was eating
and like sugar and things like that.
And so my face definitely cleared up pretty well. And I try to do now too skincare regimen. So I'm really big on that. And I wear sunscreen.
And you are what you eat. You are exactly sunscreen. Please. My people, sunscreen.
You hear that, cousin?
Yeah, we don't want to talk about this.
Okay,
let's go ahead and talk about what we eat.
You are what you eat.
Because that's an important thing. I remember a moment when I was talking to my daughter and I was trying to go through this weight loss, and I said, I have to reimagine my relationship with food.
Ooh, absolutely.
And as soon as I said that, I realized that I said it, but I hadn't really thought through what that means. And I believe that if you can't pronounce it, you probably should think twice about putting it in your mouth.
I agree 100%.
Right? So if you turn it around, you look at it, be like, how do you pronounce that?
Right. Put it down.
Yeah. So whole foods are good. Some people, to one of the things, everybody can't do bread.
Right.
That's correct. That is correct.
Yeah.
Some people
dairy as well.
Yes.
A lot of people break out with dairy.
Yeah. And so thinking about and understanding where you are, one of the things that I find is that what happens on this journey is I think we all get frustrated.
Yes.
Because we don't think about it as a marathon, not a sprint. Right. And so we've got to think through and say, okay, we're here. And it's going to take trying 4, 5, 6, 7, 8, 9, just like when you try different skincare regimens, it's going to try, you're not going to get the first time.
That's right.
And give ourselves grace. And then I have what I call accountability partners that, we check in and say, okay, what what are you doing? I ain't did what I was supposed to do.
Right. Right.
Yeah.
And that's just as important as having a mentor, you know, and I think people will have mentor in the workspace or like you said, in their mental space, but not necessarily on their health and wellness space. And I get it, you know, because sometimes having that accountability partner when it comes to weight loss and working out, you be like, oh, if you tell me to work out one more time, you know, but put the emotions to the side, because one thing I do know is no one has ever said after working out, I feel terrible. Ever. You know, like you typically end up feeling good, and it balances those hormones, it balances your mood, you know. So having that accountability partner, even when it comes to food, because we know I'm an emotional eater. You know, when things get tough, when I get stressed out, what am I going for? Something that makes me feel good immediately.
Yes.
Oh, that's your thing, ice cream girl.
Yeah.
My thing. Give me a chocolate chip brownie or some cookie or red wine.
Oh,
you got me.
Oh, Prosecco.
You got me. All my morals are out the window for a cookie. But you have to have that accountability partner. That's true.
We also have to be mindful, because I find it very interesting. Let's say you actually get to the gym, you're working out, and you're sitting there looking at the TV. Do you realize what they're pumping to you? They're going to pump to you ice cream. They're going to pump to you pizza, all these things that are good. I like them.
It tastes good.
But,
of course.
But then you're like, is this getting me where I want to go?
Yeah.
And so how do you consciously make sure the things that you're seeing are aligning with where you need to be?
So that's a good point. So I have one patient that's on it and has done fantastic. And I talk about her because she shares on Facebook a lot. And so we started her on semaglutide, and she lost a great amount of weight. I mean, definitely like somebody flipped a switch and she was on. And so we talked about that. She sent me a text and she said she has a lot of food noise. And so when she went to her, she said, I'm going to like deactivate some stuff. So she went to her Instagram account alone and had over 100 and some, like 70 something food places that she was following. And she unfollowed them all. And so that's a total mindset change. And I tell folks, like you said, this is not a sprint. This weight loss journey is a slow process. And that's what you want. You don't want to, we're in a culture and mindset that we want it quick. Yeah, I want to win $1 million.
Right. I want to quit my job.
But it's not. It's a journey. And so the slower you can lose the weight, the better it is. And so that's why this is so effective. And I also encourage, take it one step at a time too, because now, we've made the decision. We're going to really get on this weight loss journey. That's stressful in itself. And so the next thing is little things at a time. Don't look at this massive, I want to lose 50 pounds, but what's your first goal? Let's get to 10 pounds.
Right.
And so what about eating? Okay. So I always encourage high protein, low carb, because you do want to keep your muscle mass with this diet. Because if you don't, with these injections, if you don't, you can lose all that. That is a known fact. And so I encourage a high protein, low carb, no added sugar. That
that's hard, right?
It is very hard. I've done it. So I know it's hard. But if you combine those things, so it's a sensible diet, because I can eat a portion. I can eat smaller portions of the things that I like, but I'm not overdoing it.
Right.
And so that you're going to maintain a lot quicker than you would just cutting out all this stuff. And then you get bored. I know I do. You get bored with eating this stuff. And then I just want a burger and some fries. I want that pizza because I'm sick of eating this bland chicken. So, and I encourage actually journaling your food. For me, and actually I've created a weight loss journal that covers stress, water intake, exercise, oils, sleep.
Yeah. Oh,
sleep,
yes.
all those things.
Yeah, sleep is so important.
Sleep is huge.
It's so important, and for your skin.
And for your skin,
And I
absolutely.
have a food list along with
hormones
where you
too.
can journal
Yes.
your food plan for the week. And so, if you can spend 2 hours in the kitchen and you say, hey, all right, this is what I'm going to do for the week. And if you meal prep, honestly, that is
half of the battle. Yeah.
in itself. So all those things I've done, that's what I talk about. Like, but I do encourage, like, for some, I've connected with like a lady that does therapy because it's here.
Yes.
Got to go together.
Yes. And
that's a big part of it.
Well, Ken is watching, so let's say hey.
Hey,
How you feeling, dog?
What's going on?
And he said, yes, you got, come on, eyes. Come on, eyes. Yes. She's down 7 pounds in 2 weeks. I will let you guys know.
Doc, I need to come to you. I need to keep going.
And then Bean, one of our other cousins, family friend, she said meal prepping. That's huge. And then Miss Tabitha said, I didn't get the weight loss injections, but I did get the vitamins, energy injections from Dr. Janze, and I felt great afterwards. And then those in the IV drips and the injections, they also help with your skin, correct?
Mm-hmm. And so I have glamorized drip. Actually, that's really good for skin health. And so it has vitamin C, vitamin B, has biotin and glutathione. So a lot of people don't know about glutathione, which is a powerful antioxidant that is produced in our liver. And so it helps get rid of free radicals in your body, but it also helps with skin health. And so it pairs well when you're getting your...
This needs to be a thing.
We're going to
this needs to be a thing.
And so I've gotten it myself. I went through a period of like breakouts, and I was like, let me go get me some glutathione.
I want to go back to your point about doing the journal, because one of the things that happens is that we have good intentions. So here's what happens. Halloween just happened. We fall down a little bit. We slip. Thanksgiving happens. The wheels fall off.
I mean,
right?
Yes. They don't fall
by
off.
the time Christmas come, you like, man,
you're done.
Forget it.
It's out there. Yeah.
Okay. So then the new year starts, and you say, okay, I'm gonna get on this thing.
My resolution.
Come on. No. How do you, and the reason why you want to do a journal is because you want to think through what's happening to you, and then have an honest assessment of why this isn't working or is working, because this whole thing is a lifestyle, and you have to love the process. You have to love, there are some people who can eat non-seasoned chicken and rice and be okay with that.
Fine.
They're fine, but they love the process though. That's the difference. And you've got to love that process. If you can do that, then consistency is what really starts to link it in. And unless you can figure out, well, if you know that because every year by January like 31st, all those new people, about 70% of them are gone.
Yep.
Right. And and look, and I am in the gym, and I'm like, I'm sorry, but I can't wait for them folks to be gone.
Yes.
That's what you like.
Yes. All the newbies.
They in my way.
They're in the way.
Not serious.
Yes.
And I know you're not serious, because I see y'all, and the ones that are
they be
really
on the machine
bad,
like that.
right? Is I see you for that first 2 weeks every year. Like,
yes,
I see you next year.
Right.
Right. Because I don't mean to be facetious about it, but I am serious and I am there. But I have found something that I love to do. And see, it might not be the gym. It might be walking. Right. It might be yoga. Right. Yes. It might be
dancing.
It might be dancing.
Pilates. Yeah.
It doesn't have to be like this big old thing. Simple walking, guys.
Yes.
You will be amazed at just walking. And I mean like a good walk, 3-mile walk.
Yeah.
Will do you some good. And so I do encourage, like I say, I encourage people. I don't tell you to go spend, get a gym membership, but I do tell you walk a little bit, park a little bit further. And so I do spend that time, personal conversation with people. Just try to encourage. And like I say, it is definitely worth you taking that time to lose the weight, because physically you feel so much better. I've had the same girl. She's lost about 50 pounds.
Come on, 50 pounds.
She's come off one of her blood pressure medicines.
Come on. Yes.
Those are things that bring me joy. Being able to truly help. And that was the reason why I started my business. It's not to just get money, and because clearly if that was the case, I wouldn't still be working full time.
Right.
But it is to help our community get better.
Exactly.
Healthy wise, like at least get on the opposite side of things and go to a path of better health. And and it's a process. It's not going to happen overnight, but you have to trust the process.
And speaking of trust the process, Jewel, I know that, like you mentioned earlier, sometimes people will start a new skincare regimen and they'll get frustrated because, like you said, there will be breakouts or something doesn't work or the skin starts peeling or whatever have you. So what advice do you have for people with that? And what are some steps that they can take to find a new regimen?
So I always tell, especially my clients that are either new clients or people, because a lot of people message me a lot about skincare and how do they navigate skincare, and they in Ulta and and different things like right
girl.
Oh, I get a lot of FaceTime. Hey, is this good? But I tell people, one, you should always at least consult an esthetician, right? So we're all put on this earth to hone in on a craft, right? And so with that being said, I don't think you should ever walk in, because a salesperson is a salesperson. Okay. An esthetician is an esthetician, weight loss, all we do what we're supposed to do. So I tell people, start off with something very simple. Something easy, something simple. I'm not gonna really name drop when it comes to brands. Come see me.
Hello.
But in hindsight, just start with something very clean and very simple. Once you commit to that, then commit to results. Because I can sit here and tell you things that's going to give you results, but if you're inconsistent in your skincare, you're going to get frustrated and throw it down the drain. You're not going to believe me. You say, oh, it's another product I don't buy. So that's why I tell people, if you get consistent on the basics, like cleansing, toning, if you can commit to that, then I'll bring you a little bit further. And a little bit further means come to Canvas the Makeup Studio.
I know that's right.
And
let them know.
But seriously, you want to start there, and then let's talk about what your skincare goals are. Because you have concerns, but I can't help you fix your concern if you're not consistent on the small things.
Exactly.
Because you'll be surprised. A lot of people don't cleanse every day.
And don't crazy, right?
A lot of people don't tone. A lot of people don't moisturize.
I'm sorry, Black folks, every grandmother I know always used to say, go wash your face.
Hello.
But most people only use water. You can look at me like I'm crazy, but I've been in this field for a very long time. And a lot of people only use Dove soap and water.
And think that's
not going to cut it. Like, she speaks to free radicals. You're walking around all day, and those free radicals, just the environment, everything's just attacking you. And you think water and Dove soap going to do it.
Which is why you need to cleanse.
Exactly. Now, some people are blessed and water does it for them, but it's just, but then there's more things. There's texture, there's inconsistency with color. There's, you wonder why later on you have splotches later in life. You get what no matter how pretty it looks now, we have to think 30 years from now. We have to think, different things like that. So I just tell people, let's stay, the biggest tip I could tell you is going to Sephora or Ulta. I didn't want to say
that's okay,
brands, but we'll just say that because a lot of people know them. And ask for something that's clean, that's simple, and that way it's just easy. 3 steps, and you could do that. Once you do that, then come back and let's talk about corrective.
Yes.
Let's talk about seeing some results. And that kind of ties into, just being transparent on my journey. I didn't have the tools. So the reason why it never worked for me from trying to lose weight my whole entire life, because nobody sat me down and gave me the tools. Nobody said, this is what food looks like. Right. So and then with me being an entrepreneur, this is what time and food looks like. Because I was I'm gonna just grab this, I'm gonna grab that. And so, I talked to you before on different podcasts that you've had and things like that you have to take time. So thank God that y'all have somebody that is an advocate, that she's telling you, I use my product. This is what it looks like. Let's sit down and talk about that. Because a lot of times I've been to the doctor my whole entire life. I don't play about the doctor, but they never said, hey, this is what food looks like, until I met my last primary and was like, let me send you to a nutritionist. Like, let's get a good relationship with food, because you just going on the fly.
Exactly.
And it's just like a facial. Like, if you've never came and got a facial from me and you come start and get consistent facials, you're going to love your skin. And you're going to love your body once you go see her over and over again. And that's just the reality. Anything you're consistent with, you're going to see results.
Exactly.
But you have to change your mind.
Right.
You have to change how you feel about it.
And like you guys were saying, from the injections, from the gym, from skincare, it's you're going to fall in love with your body once you start feeling good and you're seeing the results, but you are going to have to take some time. And the one thing that I noticed, especially with social media, you brought up a really good point about people not following accounts that feed into, their vices. And like, especially the vices that you'll need to participate in all the time. So like the fatty foods, the foodies, things like that. People fall victim of that whole Korean 12-step skincare because they think that that's what they should be doing because my skin should look like that. Not knowing that, that's a big thing.
Oh yeah.
But our skin don't look like Korean skin.
Well, yeah.
But see, it's the result without getting the whole story. You see what I'm saying? The education. There's a lack of education. So see, that's what I'm telling you. You gotta get with an expert.
To what is the definition of beauty? And a lot of that is for the benefit of larger corporations because they want you to use 500 products,
right?
And it's their product.
Sell is sale,
right? Right.
Sell is a sale,
so
right?
This is the magic product, right? Whatever that is, as opposed to saying, and see, this is something, and this happens a lot in the gym. They will put up, wear these shoes, it'll help you do X. Wear this, take this particular protein, and it's going to help you do Y. And certainly there is some space for that, but you also need to educate yourself in, what is this really supposed to do? And how am I going to engage in it in a way in which it's not just chasing the next thing.
It works for me. It works for an individual person.
Right.
Yep. And their needs and what they're catering to. So I think that's a really good point because a lot of people get caught up on social media and they get caught on results and it's the new trend and it's the new thing and
my friend
they
look like this and I'm like, stop looking at your friend because you and your friend are
totally different things.
Yes, and it's funny that you mentioned that because my sister-in-law Chiquita, whenever you show her a picture of someone's hair, she's like, "That's nice, but that ain't your hair."
Very realistic. Yes.
So you got to be realistic about what it is that your hair can do and fall in love with your hair, just like what your skin can do and fall in love with your skin, what your body can do and fall in love with your body, what your regimen, your day-to-day, and fall in love with that. Like there is a pattern here. If y'all haven't caught on yet, there's a pattern here, y'all. Everything works together in tandem. So we want this platform is just for that. Not only is it to give people a voice, but we want to inform and then also let you know that we have the resources. They're here. We're presenting them to you.
Just ask us.
Just that's all. That's all we asking you to do.
Consultation. I even offer a basic consultation. 20 minutes.
And that was going to be my next question.
Zoom,
so
everything.
When people are interested, how do they make those next steps as far as like, the consultation process? Because some people think, well, once I sit down for this consultation, you're going to sell me on something.
I don't sell you anything. I tell you what I offer and you make the informed decision and I talk to you about the benefits. And so if you go to my website, www.embodyhydration.com, I offer a basic consultation that just talks about all of my services, IV drips, injections, weight loss. And I also offer a weight loss consultation that's just specific for weight loss. Now that one does have a cost to it because, there are labs involved and things like that. But I do that because my goal is to make sure that you're safe for the product and that we know where we're starting with. And so there's a whole process. You don't have to come see me in person if you just can't. We can actually do a televisit. So we can do a video visit and we still can cover all the things that you need.
Talk about the blood work. Why is that necessary? Because a lot of times, number one,
come on, cousin.
I don't like.
Cousin showing off.
Right.
I don't even like needles. Right.
Yeah.
Hold up. There's some. I can't tell you how many times I have gone to someone who says they taking your blood and they can't find my blood, and I'm like, and usually. Let me go ahead and keep it 100. Usually I have to find a sister who 2 taps.
It's right there.
Everybody can't with the skin, right? The color and
because they don't see it. And it's not, and I tell look, I'm a nurse practitioner and some, when we're nurses, we have like IV teams and all that stuff that but I am one that I am going to try it because I need to know it all, right? Or I need to at least know how to do it. So I'm always a hands-on person. And so I work now. I mean, I'm by myself. I do everything. And so I place my own IVs and all this stuff because nobody else is going to do it. And so it's a lot of times it is, you're not going to see it. You just have to go by feel. And it's just an instinct that I've learned. But I've always kept up my skills because you just never know when you're going to need it. And it has proven that you keep up with your skills because I'm doing IV hydration. I'm placing IVs and I got to know what I'm doing. Now, there are times where I'm like, oh, yeah, like I don't have nothing to work with. And you try and you feel horrible. But the reason I do blood work is because you need to know where you're starting. So one, your kidney function, because a lot of medicines go through your kidney, your liver function, thyroid. So sometimes if your thyroid levels are out of whack, that can be a reason why you're not losing weight. Your A1C, which is a 3-month blood sugar check to see if you're diabetes or not. And so that's big. I'm big on that. And then your cholesterol level. So let's see where you are, because if your cholesterol is high, then we can definitely talk about really cutting out certain foods. And so when you get all these high numbers, triglycerides are high, you're eating a lot of fatty stuff, but then here's your risk for cardiovascular disease. And so this is why this medication is not just for weight loss. It is not just for weight. Yes, it's a great benefit, but when it reduces your cardiovascular risk factors, so I'm reducing my risk for heart attack.
Right. Yeah.
So I can live longer to see, my three boys grow up, my bonus children, live their. I need to be there for all that.
Yeah. And then
if
one
you
thing,
don't kill them.
That's off-air conversation, cousin.
What cousin?
Off-air conversation.
As an entrepreneur, these are real things that happen in real. This is real life.
And the one thing that I want people to know too, none of this information is hidden. So when you want to know about the research when it comes to these injections, there was literally one that just came out this week about the benefits of Ozempic, of Wegovy, of Mounjaro with cardiovascular and stroke, and how it can help prevent, any of those things from happening. So, like I said, when people toss around these jokes and stuff like that, people are taking the step, which is brave, to really take control of their health. So if this is something that you're considering or something that you're doing, please take a moment to pat yourself on the back, because you are saying that you want better for yourself, and don't let anyone make you feel less than because you're needing that extra help to go ahead. I mean, because it's still hard. You still got to eat well. You still got to exercise. You still got to get your mental together, which if you're thinking about possibly getting a therapist, which you should, because we have everyone up here who has mentioned mental. Remember, we have James Perkins on our team. He will be here next week with with Miss Verna, where we're going to talk about family and dealing with them for the holidays. But
that's gonna be good.
Girl, yes. We're going to talk about it all. So some trauma might come up. might come up. I might have to slip and be like, ooh, that's too personal. But we have him on the team as well. So if you need a licensed therapist, please reach out to James, because he will help you too along this journey. And then you have Dr. Janze with the injections. You have Jewel with your skincare. And like I said, it's more than just putting moisturizer on your face. It's more than just putting sunscreen on your face. You really need to take the time to cleanse, to tone, to exfoliate, because a lot of people don't exfoliate either, girl.
Right.
I love a good exfoliate.
A good one.
Oh, gosh.
It could be chemical. It be see, come see
us.
Come see us.
And I'm telling y'all, and Kim would tell you too if he was feeling better and he was here, because I gifted him a facial for Joy, and he was like, yo, that was life-changing. And he just keeps saying, I have to go back to her. So if you've never had a facial, or even if you're out of sync with it, because the one thing that I love that Jewel said, facials are like oil changes. So this is something that you should have in your routine. You're taking care of your car, take care of you.
That's
okay,
right.
y'all. Hey now, look, there he is. He said it was the best.
Thank you.
And then he also said, I walked 3 miles a day through the summer and lost 20 pounds. Y'all saw the weight loss. You can look at our videos and see his weight loss. He said, y'all, some good looking Black folks, proud of the work being done. Made my sick behind proud. Oh, thanks for filling in, cousin.
Cousin has been really, he's valued.
And Miss Tabitha says she got the drip, not the injection. So just so you're mindful of that. And so yeah, she gets it on the first try. I know that's right.
She hit that vein.
Ooh, we're gonna talk about that, girl.
We still working.
I know you gonna get me, girl, because when I see that, I'm like, don't touch me. He said, I never felt air on my face like that.
I read all that dead skin.
And Miss Tabitha said, Jewel, where are you located?
I am located Midtown, in Raleigh, North Carolina. So come see me. My website is www.canvasthemakeupstudio.
Say that one more time because you kind of fast.
www.canvasthemakeupstudio.
Telling you, Miss Tabitha.
Oh, my Instagram, Canvas the Makeup Studio. Facebook, Canvas the Makeup Studio. LinkedIn, everything is the exact same. Canvas the Makeup Studio.
Miss Tabitha, I'm telling you right now. I don't be endorsing any and everyone. When I tell you she's the truth, you not only are you going to get a facial, you're going to get loved on. You know, you're going to have words of affirmation spoke to you because
I'm big on that. I'm really big on that.
It's all the
mental, you know.
It is.
Shout
and
out
I'm
to
tell
Kim.
y'all,
seriously,
like,
she's changed my life. It's all the mental. Yes. She came through with a therapy session. She was like, this is what you need to do. And that's what jumpstarted my whole entire life, because same thing with your weight loss. You have to change your mindset. Because if you're still thinking the same, you're going to eat the same, you're going to change, you're going to, treat your skin the same, you're going to drink the same. So you have to change your mindset for the first time in life.
Absolutely. It's a conscious mindset. And when we talked about journaling earlier, like I kind of know what I eat and don't eat, and I know what to eat. But I also journal for personal reasons. And so when you journal, it really releases a lot of what's going on. What am I thinking? What am I feeling? And so you can kind of help work yourself through some of those. But definitely therapy is always great.
Yes. So please, like I said, use James. If you don't want to use James, there are plenty of other therapists out there who are willing to help you on this journey. Contact Jewel. And like I said, I can't speak highly enough about her as someone who has had cystic acne, who took Accutane and always hated their skin. I hated my skin. I went to her and she made me love on myself so much that you can't tell me a damn thing about my skin now. Goodness. She's like, you got good skin, girl. I do. Girl. Okay. Goodness.
Make her for what?
You say.
And I don't
and don't. Fresh face, you see it. Bean said, any connections in Ohio? We'll work on that.
Might need to take a trip.
I know. Come on down.
Hey,
come on down, sis. When you come down, we're gonna take care of you, girl. You know I always take care of you when you come down. We'll visit Jewel, and then we'll visit Jan's, and we got you. We got you. Do you do hydration facials?
No, but Doc, we need to definitely link with that. That's really good.
I have given a drip while somebody's getting a facial.
Oh.
Okay, so new levels just unlocked. So you can see us. Yes. Yeah. We would definitely. That is good.
You see how I be working?
I told you she should definitely have something called Ask Him. I'm telling you. I keep telling
I be knowing y'all. One day y'all gonna take me up. I endorse quality shit. Okay. Okay. Because one thing I'm gonna do is spend money on me. Okay. All right. So Jay, I don't know. She said, or connections in Virginia. I don't know. We got to expand our network. We got to, because we do have viewers outside of the North Carolina area. So we gonna have to work on that, girl. But in the meantime, next time you come down,
you just a state away.
I didn't think about it when you was here. We should
vacationing. Come see us.
Come on, baby. We got you. So we are almost at the top of the hour. And Dr. Janze, look at you. It's your first episode. You did phenomenal. Cousin. Did phenomenal. Thank you. Jewel, you know what to do. This is your third, fourth time. So you good. You in there like somewhere.
Smooth with it.
Thank you,
cousin. You are valued. Cousin is valued. Okay.
Hello, and is. Appreciate you for stepping in. Miss Tabitha, I like you, Miss Tabitha. We're gonna have to meet.
Really is.
We're gonna have to meet. She said, I'm a supporter of people, so make sure.
I appreciate you so much.
Yes, please check out Jewel and continue your services with Janze. And then when you check out Jewel, come back and tell us how you feel. Okay. Okay.
I'm going to see Jewel too,
and I'm coming to see you. I'm coming to see you.
Oh goodness! And y'all, if you have not been watching before, most of y'all have. Ken and I are currently doing the injections. So we are going to keep you updated on our process. I have not weighed myself. So I'm weighing myself on Friday. So I will let you know and update you there. But I can honestly tell you, I'm one of those people like Jewel. I've tried it all. But the one thing that I have noticed that has helped me be consistent and has helped me lose weight is movement and walking, especially when I went to college, because I was in the middle of nowhere, so we had no choice but to walk, but being consistent with walking and working out, paying attention to what you are putting in your mouth, and knowing it's okay to get that extra help, because my family, I come from a family of fluffs. So, I do.
Well, I mean, think about it. The South, we equip being happy means eating and food. And so it's fair, but now you're being intentional with everything. So.
Exactly. So we will keep you updated with our process. And then Dr. Janze will be back. Our next episode, we will have a nutritionist on board to help you navigate with that as well. And then, Jewel's family, so she'll be back. So any questions you got for Jewel, we're going to bring her back. Because the other thing is Ms. Verna needs to get with you to talk about CBD facials, girl.
Oh, nice. Oh, yes.
Connections, girl.
Ask him. I keep telling you. I don't know why she won't have a business called Ask Him. I don't know why.
I got y'all. Whatever y'all need, let me know, and I got you. I got you.
And just to note, Ken did say he lost 7 pounds, and they've only been on. This will be week 3.
Oh, I'm definitely coming.
All he got to do is sneeze, and he loses weight.
I just think about it, and it's like a pound gone.
Okay, I'll be like, oh well, I lost 3 pounds, but good for him. Good for him. But guys, we appreciate you so much. Thank you for tuning in. Like I said, good job, Dr. Janze. You did it. And we will be back. Good job, cousin. Appreciate you. Jewel family, appreciate you as well. If you guys have any questions, or if there was something that you think about after the episode, please feel free to reach out to either one of them. One more time, drop your information.
So www.embodyhydration.com. My Facebook is Embody Hydration and Wellness, and my Instagram is Embody Hydration.
Nice. And my website is www.canvasthemakeupstudio, and my IG and my Facebook and LinkedIn is Canvas the Makeup Studio.
Oh, and Miss Verna said, "Yay, Dr. Janze." Okay, so we're gonna get get everybody. We got Jewel, we got Janze, we got James, we got Verna. We
got you covered.
We got you covered.
Health and wellness.
Yes. And then we just want to love on y'all. Love on yourself. That's it. Okay.
You matter.
I know. Y'all have a good week. You have a productive week, and you don't let anybody get on your nerves. And if they do, you just remember, Miss Verna has her drops on sale. You buy one, you get the Wakey Wake tea. And I'm telling you, it'll save your life. I don't endorse bullshit. Thank you for tuning in to TDS. It's Embody Balance with Dr. Janze. We'll be back next month with a whole new episode. Bye, y'all.
Bye.